Bangalore, and then we'll enter Mangalore and other places. And then the most important part is we'll associate with various organizations, and various neurosurgeons have come forward for the lectures. My work is only to give you a foundation knowledge up to now, that when they speak about something, you may understand what is the structure of what the brain they are speaking of. When they speak about some deficits, when they speak about some other issues, you must be able to in a position to understand what they are speaking of. So when we speak about the most difficult structure about our life is brain architecture. Brain, archi- Brain architecture is one of the most beautiful subject which we like to explore, and we would like to continue. So today we'll speak you why this is required, because this is required to understand the pathologies of the brain. The pathologies occurred because of neurodegeneration. Pathologies occurred because when there is a stroke, in which area of the brain it is stroke, and what we are losing out of the stroke. That is the most important part which we are learning today in this. So the most important is architecture, exploring the organization of the brain. The human brain is remarkable and complex organ made up of different distinct structures work together to support our cognitive, sensory, and motor functions. In presentation, we will develop to the intricate anatomy of the organization of brain, examining the key components that contribute the remarkable capabilities. So we understand one very, very beautiful sentence here. When we explore the brain, it is consists of more than 1,000 billion neurons having different localization, and it is responsible for your cognitive, sensory, motor, everything, whatever you are doing today. It is responsible for this, and because of this activity, we are in a position to do what we are doing today. So always it is said, it's a beautiful saying in Jainism or any other Islam also it is said, never fill your brain with clutters. Always leave the space of clutter and let beautiful knowledge goes inside. So the more you fill your brain with clutters, the knowledge is reduced and your recovery will become less and less, and the difficulty of recovery will become much lesser than what it was before. So brain's role, the brain enters in the human responsible for coordinating wide range of functions, including sensory, motor, perceptions, processing, and emotional regulation. So human, see, we know everything, whatever we are today, is a role of the brain and the mind. So when we speak about the brain, we must understand it is responsible for various everything, whatever we are today. The existence of today and ours is dependent on how we have trained our brain. You see, the moment you train yourself with the moment you train yourself with the brain, higher activities, the higher and higher it goes. And the moment you train it with lower activities, the lower and lower it. It is all up to us how much we can train, how much we can take out of yourself, and how much we put ourselves in interest of learning. So that is what we were thinking. After some time, the family will expand, and a small family will become big, and that is what the brain says. And that is all what we call as neuroplasticity. We all come from different places, different organizations, different approaches, different understandings, different knowledge base. But after some time, what you will see, we unitedly stand for one feature, that yes, this is possible and that we can do it. So when we understand with this phenomena that yes, this is possible, this can be done, and this is all we are trained for, and that factor is called neuroplasticity. The upcoming of the neuron create new pathways inside the brain, and altogether the beautiful structure which is formed to create the neuroplasticity. It is said, when you work together in answering the questions, you see so much vocabulary is there in my mind, so much words are there in my mind, so much phrases of sentence are in my mind. But when I am speaking to you, I am speaking to you in such a way that all this sentences, whatever I wanted to speak, are to the fact findings, and to the logical way very which you can understand, right? You are able to hear me, or am I speaking too fast?
Yes, sir.
No, sir,
Yes,
it's
sir.
okay.
You're
Yes.
all right, Sastry,
Yes,
know.
sir.
Yes,
See, if I
yes.
am running too fast, then
No,
please
no, sir.
stop me, right?
No, sir.
Because we also don't know how fast we are running, right? It is you who should know. It is practically the classes for you people. So if you don't understand what I am speaking, the coming of me in the speaking in the class is useless, right? So it is
Yes,
the best thing is that you have to make me like you in the way you understand, right?
yes, sir.
The brain is composed of many parts. What there are three parts which are the architecture anatomical overview. When we speak about the structure, first comes the anatomical overview. So comes the cerebellum, and the brainstem. So brainstem is the extension of the spinal cord. From the extension of the spinal cord, you will see a olive green structure which is near the fourth ventricle. So you will see a triangular formation that is called the ventricle of extension from the spinal cord, extension from the brainstem, and a olive green structure where you will see olive leaf structure you will see is called cerebellum. Cerebellum. The major structure which is consists of the brain is cerebrum, and when they work together, they become a remarkable organ, and that is the human brain. So when all these three work together, they become a remarkable organ. What is because you are there, you are a remarkable person because Allah, the Vaheguru, the Rahim has created you in such a way that today you are a remarkable person. And that is why it is said, if you make, if you learn all these things, the doubts, the most important part of human life is to remove the fear. And the fear can be only removed from your brain when it is admitted with good knowledge and with good what? When you good put more and more knowledge, the more and more fear comes out. And then when your foundation is clear, nothing can shook your knowledge. And you can stand together and you can learn together. That is what the brain says. All those neurons which fire together wires together, right? The cerebral cortex is the outermost layer of the brain responsible for higher cognitive functions. It is divided into four major lobes. So, what are the four major lobes of the brain? Frontal, parietal, occipital, and temporal. What are the four lobes of the brain? Frontal, parietal, occipital, and temporal. So, they are the higher. They are, if you see, so how do you understand about the growth? So, the higher valley and the lower valley. It's like the hill. The higher valleys are called the guidus, and the lower valleys are called the what? Circus. The lower valleys are called what? Circus. So it is divided into two parts. What are they? Four. Frontal, parietal, occipital, temporal. And according to the work assigned to them, they work and they perform their activity. The frontal lobe has this motor, cognitive, individual understanding, right? Sensory has a sensation role, right? Temporal is gustatory, ossificate, hearing, smelling, eating, and the seeing part comes from the occipital lobe, right? Frontal and parietal is divided by central sulcus, then frontal parietal further divided by a lower feature is called lower line is called sylvian fissure, which to make this temporal lobe. And from temporal lobe, if you see, there is a very clear cut in the posterior part, and it is called what? Occipital lobe, and it is divided by calcanean fissure. So there are the four major cuts. Which are the major cuts? Central sulcus, calcaneal fissure, and sylvian fissure. Frontal and parietal is divided by central sulcus, parietal and occipital by calcaneal fissure, and frontal parietal occipital is divided by sylvian sulcus. So it becomes a temporal lobe. So what are the three important four parts? Frontal, parietal, occipital, and temporal, right? The cerebral cortex is composed of gray matter containing the cell bodies and dendrites of neurons. It has a characteristic wrinkled appearance with deep grooves, sulci, and ridges, which increases the surface areas, allows us for new connections which limit the space of the skull. So that will come across much over it. But in this feature, we admit only one thing. Brain is divided into four parts: frontal, parietal, occipital, temporal. And their boundaries are called central sulcus, calcaneal fissure, and temporal lobe. Calcaneal fissure and sylvian fissure, right? The frontal lobe is the largest of the four major lobes. The brain is responsible for a variety of crucial functioning, including motor control, decision making, problem solving, and language processing. The most important part, I am speaking to you about everything today, you are able to understand by which of the lobe is the frontal lobe. So you can see the color of the red is frontal lobe. It is more important for what you call execution of higher activities, and so within the frontal lobe, different regions are associated with specific cognitive behavioral functions such as primary motor, prefrontal cortex, and the premotor cortex. So we can understand. Uh, so within the frontal lobe, the areas are divided into various areas. The most important are the prefrontal lobe, the motor cortex, that is the area between the central sulcus to precentral sulcus, that is called the homunculus. So when we speak about the homunculus, we understand that it's the area which executes our motor area of the brain. The executing area is the motor cortex, but it takes information from the sensory areas. It takes information from the all the sensory inputs, including the eye, ear, mouth, and everything. So all this is a very complex combination of execution of the movement of the hands, because every muscle, every area, every nerve is originated with a particular area of the brain. And when there is a certain issues of the certain issues inside the brain, particularly because of CVS, cerebrovascular accident or anything, the frontal lobe can lead to the range of neurological and psychiatric disorder, including impairment motor skills. We know paralysis is called impairment motor skills, memory deficit, personality changes, difficulty in decision making, and problem solving. So whenever there is a problem in these things, what do we understand? They say whenever there is a damage, when you see there is MCA infarct or anything which we find inside our brain, we understand very beautiful thing is what the motor dysfunction in the frontal lobe. It can lead to neurologic depression and all comes from these areas because it's a part of the memory and then you keep thinking, overthinking, and you lead to a psychiatric disorders. Memory deficits, yes, if you have seen one patient which was referred by Naman, the patient has memory deficits. She is on vegetative stage. One more patient has been referred by one of our people from our group. She is from Pune. This is having a memory deficit. And this memory deficit, whenever you see, comes from the dysfunction of the frontal lobe. So frontal lobe dysfunction is most important part in understanding the motor execution, means motor part of the area, means working, writing, written, and everything, whatever you are deciding, whatever you are today there, the frontal lobe plays an important role, right? For example, I'm moving my hands like this, doing like this, doing like this, doing like this. All this is what? The activity execution of the frontal lobe. So if you lose something here, you lose a large number of things. The parietal lobe is the top back of the brain behind the frontal lobe. I told you there is a central sulcus, and this central sulcus. So here you can see this is central sulcus. This is a frontal lobe. The yellow part is a parietal lobe. So this is the central sulcus, the line, and it divides this area into parietal lobe. It integrates the sensory information from various parts of the body. It is crucial for spatial awareness, attention, and language processing. So if I speak something, anything which you don't understand, I speak, did you understand? No, you did not understand because such information was not stored in your brain. The primary somatic which process touch, pressure, position is found in the parietal lobe. Damage to this can lead to a variety of neurological deficits such as difficulty in visual spatial tasks, impaired body awareness, problems with mathematical reasoning, language comprehension. Understanding parietal lobe functions is increasing for diagnosing and treating condition affecting to cognition, sensory perception, and motor control. So, first important thing which we understand in motor control is why we need different types of stimulators, why we need to understand different stimulating range, why we have to understand what is the role, because it is the brain which has to control the difficulties. It is the brain which has to play a major role in the impairment of the body, awareness, and the skills. So when you lose this parietal lobe, you lose lot of skills inside the body, right? You lose lot of skills, and that is your reasoning ability, the language, the comprehension, the word, the vocabulary, and everything. If there is a problem, you lose it. And to regain is called the neuroplasticity, and the losing is called the deficit. So here we have completed about the minimal part of the parietal lobe. This is called the temporal lobe. Now you see, this is the central sulcus. This is called the precentral sulcus, and the area is called somatosensory cortex. Right? This is the frontal lobe. This is the parietal lobe, and this is what I call calcaneal fissure. So this is the occipital lobe, and this is the sylvian fissure, right? And this is the first, and this is the second. So it is divided into three areas. Temporal lobe is again divided into three areas, right? This is the brainstem. Brainstem is divided into medulla oblongata and the extension of the spinal cord, and this is called the cerebellum. Here you will find somewhere the what? The fourth ventricle, right? So temporal lobe is one of the major lobes of the cerebral cortex in the sides of the brain. It plays a crucial role in processing auditory information as well as memory formation and retrieval. So whenever you see there is a problem in the memory retention, the frontal and the temporal lobe plays a role. So whenever you see that there is a hearing deficit, you cannot hear properly, you can understand properly. Which area of the brain lobe is responsible? It is the temporal lobe which is responsible. The Temporal lobe is responsible for a variety of functions, including hearing, language processing, memory, and emotion. It contains the primary auditory cortex, which processes the interprets sounds, as well as areas involved in speech, language, and comprehension. Damage or dysfunction in the temporal lobe can lead to various neurological psychiatric disorders such as Alzheimer's disease, Parkinson's disease. So you can understand which lobe of the brain creates Parkinson's, Alzheimer's, schizophrenia, and temporal lobe, epilepsy, and auditory processing disorders, and early detection. So we can understand the early detection of these areas, damage in these areas can lead to what? The deficits occurring in that area. That is the depriving of its original functions. The occipital lobe is a visual processing center. You can understand is a occipital lobe that the area, the line which is drawn is called the calcaneal fissure. It is responsible for interpreting a visual information in various patients you will see around the stroke, where a stroke there, and color recognition, object identification, and spatial awareness is deprived. You know why it is deprived? It is deprived because which lobe of the brain is involved? The occipital lobe. Damage or impairment to occipital lobe can lead to various visual processing disorders such as color blindness, visual field defect. So how to find it is suffering from visual field defect? It is admitted by the field of vision test. It is admitted by the field of vision. Yes, and difficulty recognizing familiar difficulties, understanding anatomy and functions of occipital lobe is crucial for diagnosing and treating neurological disorder that affects the visual processing and perception. So if you see now, four areas of the brain has its own way of functioning, own way of understanding, own way of working. And that is why I said that everything has its own way of purpose of every purpose of is have a very good purpose. So when you speak about every purpose, every neuron works in its own way. And let us take one example today. I was creating a group of all the principals and the colleges together. In between, I just mistakenly added the Lieutenant Colonel from the National Defense Academy was the administrator from there. I mistakenly added him and immediately I removed him. Right. So I thought it's not good. But immediately a message came to me, sir, please add me to this group. I'm more interested to learn. And then I came to know one thing. Nothing goes for even one wrong click got as a what? Purpose to it. We may not understand the purpose now. Purpose is known later. So when we know the purpose, the more and more we come up and the more better we become. The basal ganglia, now you see basal ganglial hemorrhage and all you will see in the MRI, right? So now you have to understand what's the ganglia group. It is interconnected structure deep within the brain and play a crucial role in motor control, learning and habit formation. So whatever you're saying, smoking, chewing, bad habits, good habits are formed where? In the organization of the basal ganglia. They help to voluntary movements, inhibit undesirable action and facilitate the smooth execution of complex behavior. So, for example, you are watching a lot of wrong things in the computer, and then and you suddenly get excited, and when you start functioning, which area of the brain empowers you to do all these things is the basal ganglia, because all the wrong inputs were given here, and when the excitement comes, it goes to the wrong output area, and that is the area which makes you responsible for doing reps and all these things. So it is always better that you don't see wrong things, don't hear wrong things, and don't speak wrong things. That is why it is very important for us to understand the structure of the brain. So Bayesian, and it is plays a crucial role in the motor control, learning, and habit formation. So that is the most important part in capsule ganglion area, basal ganglia area, right? Thalamus is crucial relay station in the brain, receiving the transmitting information to and from various cortical, subcortical areas. It plays a vital role in sensory processing, motor control, and regulation of conscious arousal, sleep, awake, and cycles. So whenever you suffer from any type of problems, especially you see the more the age comes, because we suffer from lot of problems, lot of issues, lot of things comes to our brain, and it is called thalamus. So thalamus is responsible for that. And the more your sleep cycle is damaged, the G lymphatic system, the drainage of the brain is not working. And the moment you see the drainage is not working, you suffer. And you suffer very badly in that state. And below the hypothalamus is the hypothalamus, right? So about highly complex structure that serves as a crucial link between the nervous system and the endocrine system. So now you can understand this plays a very crucial role in between the nervous system and the endocrine. It regulates the essential psychological processing such as body temperature, hunger, thirst, sleep, mood, release of hormone, pituitary gland. So here you can understand the brain is so widely divided in various neurons, various areas, various geographical areas. So many people ask me one question, which way, how to recover a paralysis patient? I tell, without stimulation from the brain, how can you recover it? You are speaking about various areas of the brain which has to be revived, which has to be refunctioned, which has to become bring the functional recovery. So it's not only about the NIBS, it's about the details of the brain mapping. We are also having a shortly a class in on Power जी कब है class brain mapping का class.
सर 8 9 10 दिसंबर.
Yeah, 8, 9, 10 in Hyderabad only. In this room only where I am teaching. So we have kept the batch very small, 8 to 9 people only, so that we can teach the details about the mapping. Because if you have stimulators, if you don't have input, if you have inputs and you don't develop an output, there's no use of wasting anyone's time, right? There's no use of wasting my time with you, your time with me, and instead of creating confusions. And the most important part here, you can see the feeling of jealousy comes inside, that he knows more than me and I know less than him, right? And then that is where the ego plays. And that is why we say their brain is divided into three parts. What are they? Reptilian, limbic, and reptilian mind, limbic cortex, and the neocortex. So the reptilian mind is always found where in these areas of the brain, right? And this reptilian mind always comes with ego. And that is why it is always said that we should keep our name in Quran and everywhere it is said. We should keep chanting the names because it regulates the temperature, cooling and cleaning of the brain. It regulates the cooling and cleaning of the brain. That is why he said we should eat healthy food, we should do healthy things, and we should perform healthy activities so that you don't fall sick, you don't fall this one. And whenever you have a critical case, I always advise you, don't try to burn your hands. After burning your hands and learning from it, it is better that let a group of doctors manages it in a proper way, in a proper atmosphere. And after he comes out from a proper environment, right? Then the patient is with you. What is the harm if he is not there for 1 month with you? The patient is going to be lifelong with you. Am I wrong, Pawarji?
Yes, yes, sir.
You are bringing your father to me, and I will always advise that please give him enough time to revive.
Yes.
But you will say, no, I want to finish it in 15 days. Then I will say, okay, you do whatever you like.
Yes, sir.
If you want to go according to me, you have to understand what I am thinking. But if you want to think whatever you like to think and you want to impose whatever you are thinking, then I will say, do as you like and think as you do. I cannot change the anatomy of your brain and thinking process of your brain. So when I was saying about the olive structure, this is the olive structure, right? This is called the cerebellum, right? This is called the cerebellum structure. It's like a olive green leaf, right? So now whenever we see these areas, basal ganglia, a group of subcortical nuclei located deep within the brain. So basal ganglia is located with stadium. Stadium means caudate, nucleus, and putamen. Caudate nucleus and putamen. Globus pallidus, substantia nigra, and subthalamic nucleus. So now you can understand basal ganglia is a role where substantia nigra is there, from where the dopamine is released. But again, when we speak about Parkinson's, the gut has to play a role. The serotonin, the dopamine, all comes from where? This is the area which we have to understand very beautifully about these structures. Right? They include the stadium, the caudate, the nucleus, caudate nucleus, and putamen, globus pallidus, substantia nigra, and subthalamic nucleus. So this is called what?
Basal ganglia.
Yeah, these are the things which you find structure after structure and structure after structure. Now you see in every structure the role of the working is different. So it is just like saying in India and Nigeria and uh, Hyderabad, all these have their own culture of language, speech, and activities, right? Can you make it one? No. So can you go in Tamil Nadu and speak Rajasthani? Is it possible? Can you come in Marathi? Can you speak Marathi in Hyderabad? Huh? Can you
No, sir.
impose rasam and rice in Maharashtra? No. Rasam and rice is just an selective item. But when you improve this, what you call the food which is in your memory, and all these things, and you go to North India, you will get it. But when you come to South India, you get what? Idli, vada, and this is the local item, right? Now it becomes very difficult for me when I go to other areas. I'm a combination of North India and South India, so it becomes very difficult for me to. Uh, Neither I can eat South India nor I like North India. It has become a mixed memory. North India, I cannot take it because it is too spicy. I'm habituated of eating idli twice a day as my food. And when I speak about South India, I'm bored of eating idli. But when I go to North India, I cannot digest the food of North India. So I'm middle of like a cricket ball. The bowler throws and the cricket player brace. I don't know where I will land. They allow in voluntary movement, motor learning, habit formation. They also contribute in cognitive and emotional processing. So this is where we say the basal ganglia role is very important. That is why I say if you have to control the Parkinson's, you have to understand the Alzheimer's, you have to understand the G lymphatic role of the brain, the deprivation of the drainage system. We call the removal of the shit from the brain. So when you are sleeping at night, the brain is clean, cooling and cleaning of the brain happen. And so it removes the shit. So until or unless you understand all these things, the lymphatic system, the drainage of the things, there cannot be a motor good synapse functions. So when the interneuron communication is not proper inside the brain, when the gut and brain communication is not proper, when things are not proper, how can you get proper answers to your questions? The proper question is 2 into 2 equal to 4, but you are saying 2 into equal to 10. Yeah, that is also correct. 2 into 2, when you speak into brain, it's the power of the function is 2 into 2 is equal to 10. But when you speak about 2 into 2 equal to 4, so you speak about the polarization and depolarization of the neurons. That this one neuron depolarization, presynaptic neuron to postsynaptic neuron, the connections, The space between them has to become very strong. And when they become very strong, like this, cut, khata, cut, we call it, when it becomes khata, cut, you perform very well. You see, we have recovered one very good case of Parkinson's in a few days. How? Because we understood the cleaning and cooling of the brain. Tomorrow I'm going to put the patient on face mask. And from tomorrow, we'll put the patient on BPAP because the patient is Parkinson's, and I'm very sure our night oxygen is very low, and that is why we can understand this happens, and that is why we call it dystonia, uh, Huntington's disease, Parkinson's disease, and all serious typical types of Tourette syndrome, OCD, and addictions, right? Especially mobile addictions in ADHD children. All this takes place where? In the basal ganglia. So if be careful, because that is why it is said, be careful in developing bad habits and good habits. Uh, Heredity has iron grip on man. So if you inherit those qualities, and if children form these qualities, I'm sure it will not go in their long run. So always it is said, develop a good culture at home, develop good things inside your brain, then make a brain free of clutters, make a brain a beautiful place where God and you stay together. And when you leave this world, you live with happiness, not with sadness. And when you live with the world with happiness, there should not be any guiltiness in your mind. So never try to take wrong decisions in your life. And if you take wrong, we always say, Kamat Khavana. So in Jainism, it is said, Kamat Khavana means, please forgive me for all whatever I have done and undone, knowingly, unknowingly. So the moment when you say these words, the emotions triggers what you called the non-guilty hormones, and they clean the guilty neurons. They clean the system. That is called G-lymphatic system. This is why it is called Sabdahi Brahma hai. So it is said the one drop of tears has 99% of emotions. So be careful before you speak. Be careful because these have the deep intellectual capacities, right? What we are developing in you is your intellectual capacity. You're trying to understand more and more. The moment you understand more better, the understanding goes more deeper. You will be able to understand and recover better. Because ultimately, tomorrow, when a person will come and the neurosurgeon will speak, oh, this is the basal ganglia, and then you see, what is basal ganglia? From where comes the Parkinson's? The moment you will understand it is a caudate nucleus, global pallidus, substantia nigra, and subthalamic nucleus, and more important is Parkinson's, Huntington, dystonia, right? Primary hand dystonia, secondary hand dystonia, this is writer's cramp. All this happens here. Tourette syndrome. This is all the basal ganglia disorder. So this is the most important part you have to understand. Am I clear to all of you up to now?
Yes, sir.
Any doubt? Anyone is having
Yes,
any doubt?
yes, sir.
Yeah, tell me what is your doubt? Anyone is having any doubt? The thalamus serves as a central railway station in the brain, receiving and integrating sensory information from various sources from before transmitting it to the cerebral cortex by higher processing. So thalamus is uh, everything is the processing of the information, right? So the moment you process, you execute, right? So it is called CPU, Central Processing Unit. So you take information. So suddenly a person who is known to me comes inside the room, and then you say handshake. But the moment I see another person who comes, I stare at him. Who are you? Right? The first thing I say, who are you? So this is thalamus is the center relays information that integrates all sensory informations before transmitting into cerebral cortex for higher level processing. So for you see, all the enemies are surrounded by you, and you have to take a complex action. Like Major Setan Singh in Arunachal Pradesh is a very famous story. Major Kuldeep Singh, you might have heard this name very well in the movie called Border, right? Major Setan Singh was a person who saw all the enemies surrounded by him. So his central relay station says, oh, he has to create a very good camouflage. They came to know that there was only one person, Setan Singh, right? So there is only one major of Indian army. But that major played a so important role. He put all the LNGs in different locations. And whenever the enemy was coming, it was firing from that direction, firing from this direction and that direction. And today you see that area of Arunachal Pradesh is still in India because of one single person. And that is why you are put to a hard training in army so that you can take difficult, your instinct becomes difficult, your way of understanding becomes difficult. And that is what I was thinking, that when everyone becomes very much critical, when your analytical power becomes critical and analytical, but when your power of the brain becomes critical and analytical, you can analyze and solve a ritual problem. For example, you are trained as a neurosurgeon and you have gone under various situations and various training and various functions, and immediately you rupture a artery, right, in the OT room. So immediately corrective measures you can take it. But if you are not trained, how will you do it? Right? So this is what we have to understand. The thalamus plays a critical role of maintaining the conscious arousal, sleep, wake cycles, regulating the flow of information between the brainstem and the cerebral cortex. Now, why it is very important? Now we see that people who are drug addict like pregabalin, gabapentin, I think all of you have overcome this problem in the clinic, right? People are always, because most of you are dealing with pain, sciatica pain, right? Am I correct, all of you?
Yes, sir.
Yes,
Yes,
sir.
sir.
Yes, sir.
Almost.
So now the most important part is the sleeping cycle. The moment you start tapering the drug, the patient becomes more and more what? Violent. So to understand those things, we have to understand which kind of points plays a major role in which is area of the brain is responsible. The thalamus is responsible. When we speak about Parkinson's, substantia nigra is responsible. We have to target the enemies which are responsible for that. And we have to remove we have to clean that area of the brain. And that is why we have integrated very beautiful part. We have integrated Ayurveda. It is very beautifully said because under the vision of Dr. Ayub Cherian, we did a very simple thing. We bought neurosurgeons integrated with Ayush. Now we are collecting the name of all the principals, numbers of the homeopathic colleges. If you have any one of you who is a professor or a principal of a homeopathic college, please push on the number to us of a physiotherapy college so that together we can sit and frame and discuss the goodness of that subject to be here and here to be there. There are a lot of things which are very good in homeopathy. You see, when I speak about my throat, just 4 drops of rescue remedy. It is the best flower remedy. And my throat is clear for next 2 hours. I don't have to chew again, and this. And I was so frustrated of chewing this, what you call, strepsils and coffils. Places like Gurgaon, you cannot take coffils, you know. You know, उसको बोला कॉफिस पे के खा के वो नहीं चलाएगा गाड़ी गुड़गांव में. क्या नाम है तुम्हारा दोस्त? सचिन, क्या सुनील, क्या नाम है उसका?
नमन
क्या नाम है उसका?
नमन
अरे तुम, हाँ, अमन, अमन, हाँ, उसको बोलना कॉफिल्स खा के नहीं करेगा, नहीं तो वो सिगरेट टेस्ट, वो कॉफिल्स have alcohol, and the moment he gives alcoholic taste he will be tapak, khatak. Tapak means what? He'll be caught,
Need iron.
and then, huh?
Go to sleep. Go to sleep.
No, 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 Chalan. It is not sleep, it is Chalan. All the cough, syrups, and all this they have what? But when you speak about Ayurveda, you see, Dr. Aibcharan is so fond of Ayurveda. He says that in my family, no allopathic medicine is advised. They go to any problem they have, they go to their herbal doctor who's their family physician. And even the children of Aibcharan are not given single allopathic medicine.
Wow, what a great sir.
That is the most beautiful part we see here. We all speak that yesterday I was getting a message that people are depriving ego and all. See, where is the ego comes? Where there is lack of knowledge. When there is knowledge, there is no ego. जब मैं था तब हरि नाही अब हरि ये तो मैं नाही सब अंधियारा मिटी गया जब दीपक देखा मैं when I is there, there is no knowledge. And when there is knowledge, there is no I. It is only what we have to accept. And this acceptance comes only from a very wide knowledge of acceptance of the theory. When I speak about for the first time about NIBS, 25 years back, I spoke about NIBS. How many years back? 25 years back, I spoke
Yes.
for the first time NIBS. And these people used to call it Kachua theory. It was taken by a turtle theory and it was used for the band management. And it was famous by Prakash Jain. So Jain used to say, oh, put your hands like a turtle, right? So wherever there is a pain, you insert the needle and the pain is gone. This is how we started 25 years back, the pain management and the NIBS. And today you see from there to the recovery of most critical neurological disorders, complex problems, endocrine problems, we are able to resolve it. So because we are able to resolve it, why? Because we are understood. For example, when I came for the first time in this Zoom classes, every time I wanted support. Varun told me, sir, Varun taught me how to take this eraser, these, right? So see, these markings are there. Earlier, I used to tell them how to remove these markings. No, they taught me. Every day when I come to Zoom, I am one level up. But when I saw the Zoom for the first time in Gurgaon, I was saying, I don't know anything. I don't know anything about lab. I don't know anything about the projector. I used to call this Sachin, Naman, you do all these things. But when I saw them doing, functioning, understanding, and then I realized, oh, it is so easy. Why I need to take their support? Still, I'm learning things. I'm still able not to put the Zoom link in the main page. So every day I also go to this, what you call WhatsApp, right? And then from there I press the link and then I come to Zoom. But tomorrow, day after tomorrow, I will know that how to enter the Zoom from the main page. I don't know how to put the link in the main page. But the link which was taught to me, right? This is where we are having a problem. We don't try to learn new things. So the one who gave me this link, right? He taught me, helped me to create a permanent link, which I gave you in WhatsApp, right? I gave you a link in the WhatsApp. So I use that link every day to enter the group. I don't know how to enter it from the main group. I also enter it through the WhatsApp link. But tomorrow, day after tomorrow, I learn this also, that also. And everything which I learn will improve my knowledge and cognitive features. And that is what you
Yeah.
understand. And that is called what? The neuroplasticity of the brain. The continuous evolution of activities, understanding, and functioning brings revival inside the brain. And that's all what we are looking for. So now the hypothalamus plays a crucial role in regulating the body hormone production and releases. It produces hormones that controls the essential functions like metabolic, body temperature, and stress response. So adrenaline crisis, the most important part is the adrenaline crisis. flight, fright, and freeze. So this is the hormone regulation. The adrenaline is high. So whenever there is a high adrenaline, what you will do? You will fly away. You will flight away from the situation, right? So taking a right decision in the right moment in the right situation is why you are trained for, and that is why you have to go through. So when you go to a National Defense Academy, I recently toured a National Defense Academy, and I saw how a 18-year-old person by the age of 22 or 21 he becomes a gentleman. And my only saying while seeing the picture with the ambassador, he's a senior IFS officer. I was sitting there, and Brigadier was sitting next to me. And then I saw, and I just commented a beautiful word from my mouth. What was that, you know? This is where a gentleman is, where a man becomes a gentleman. Where you can rely giving him AK-56, the most difficult weapons, which with one shot he can kill 56 people. But he is trained in such a way that he knows where to use the weapon.
Yes.
Huh? That is called the training of the army. So you go under a complex information process. So when you are learning, you are going through a complex information process. Now you understood why different map, zone 1, zone 2, zone 3, zone 4, zone 5, zone 6, zone 7 is required. Because every muscle has a complex activity. Every muscle has a joint complex activity. What it is called? Every muscle has a joint complex activity. Write down. This is a very important point. Every muscle has a joint complex activity. Joint means each muscle has an innervation and what? Shivani? Innervation and Shivani?
Yes, sir.
Ah. Huh?
Every muscle has a specific nerve supply and a specific group of movement that performed by the muscle.
And this, for example, uh, okay, let us take one more example. Dr. Pandian, are you there? Dr. Pandian?
Yes, sir, I'm here.
Dr. Pandian, you have referred me one patient of cervical radiculopathy.
Yes,
Did
sir,
you
correct, sir.
observe what was wrong with that patient?
Sir, so in that case, the small node is there, sir, in a
Huh.
thoracic vertebrae, and
Hmm.
his left side of cervical C5,
Hmm.
C6, and C7 radiculopathy is there. Compression of nerve is there, and the canal
Right.
stenosis is also there.
Very good. Now, what is the biggest thing did you see observe in that case?
Sir, I tried all the treatment, so I got only temporary relief. So I referred the case to
So,
you.
so after you referred the case to me, today I asked the patient. We saw he is suffering from bradycardia. When we took out
Oh,
the ECG, we found that he is suffering from bradycardia. Immediately we did
oh,
the 2D echo.
okay.
So he's suffering from high anxiety neurosis, right?
Hmm.
Number two, when you see C5, C6, the triceps
Ah,
are involved, right? You
yes.
do not see the triceps have started wasting of muscles. There is the amplitude and NCV studies when we did today, his amplitude was resumed. The NCV nerve conduction was very much less and wasting of muscles have started. So after some time, this patient would have not been able to lift his hand up to this level because the triceps has been lost.
Oh,
You understood?
yes, sir.
Where did you make the mistake, Pandian sir?
So I
So what?
didn't check the heart rate level and all
Ah,
because only focused on
yes.
that C4, C6.
Yeah, C4, C5, C5, C6, C6, C7, right? See, when the
Hmm.
person is complaining, right? When he is continuously complaining, always hear what he is saying, the tone of his words. And never excuse yourself from the tone of his words. If he is saying something, there's a truth behind it. Hey, please stop this drawing. How much I will rub all this? Who is doing this? So, whenever we speak about a disease, we must know the pathway of the disease, what is going wrong. So immediately what I did when we did this, what you called what do you call ECG, we found bradycardia. We immediately referred. The medicine doctor was sitting next to us. Immediately the radiologist came. Immediately we took out this 2D echo. Immediately we took the NCV test, and the patient was saying, "Sir, I'm very thankful to you." Now we have progressed a step with EMG studies, right? And what was the word that the patient said? "Sir, I'm really thankful to you. I will never forget you about in my life. I really suffered for 6 years." I said, "Your sufferings will come down, Baba. Don't worry." You have referred by one of my favorite student. Only this is the words which you have to speak. And that reduces what? The adrenaline crisis. So when you reduce the adrenaline crisis, it comes to a comfort zone. And that is why I always say that you have to go to a higher level of practice. The practice should always go to a higher level. Why you have not been able to go to higher level? Because your sensory informations, whichever I proceeded to you, did not have a strong foundation on it. So you could not process what I was speaking. So you were thinking brain and muscle will improve all the muscle power. So let us give Pandian that patient and let us ask Pandian to recover that compressed nerve in the which has lost its neuropathy, which has created a neuropathic symptom in what? Tricep area. To recover this, no? But you see, after a month, you will see the triceps are recovered. That is why it is saying initial study, group study, joint study, recovery study. So it was very lucky that we five doctors were sitting together. I told madam, please see ECG. So ECG, immediately bradycardia. We went with this. And then we asked the orthopedic, see what is the problem. He's having a nerve block. And immediately we informed our neurosurgeon. He said, surgery is not required. We have to go with the conservative block system. You imagine, within half an hour or 40 minutes, he was saying, I have to go home, I have to go home. He created a lot of pressure on me. But then I did not come into adrenaline crisis, right? I did not wanted to throw him out. What did I say? Everything will be okay. Just wait for 30 minutes. If you go outside, you have to pay 9,000 rupees. For 2D eco, you have to pay 5,000 rupees. For, for block, you have to pay around 7,000 rupees. So 9 plus 7 plus 4, 15 plus 5, 19,000, 20,000 you are going to waste. So when the doctor is coming, they are coming now. Do one after another. So when he did one after another, he got his conclusions. So anxiety oxidative stress was destroying his nerve. His lifestyle, you see, you have not given him cervical pillow and cervical collar. So all these things we have to correct. And always I advise you, please keep them in writing. And always keep a note of the file of the patient. Right? When did you advise him? What did you advise him? Because when I asked your patient today, I advised you to buy this cervical pillow and collar to use regularly. He said, no, I did not advise. I said, this is the first advice I give. But then the patient knows if he says yes, he will be scolded. Baba, why should I scold him? I will only say, please don't do it. Otherwise, your nerve will damage your muscles. Right? So this is how diagnosis is done. Scientifically, properly, and with the team, you can recover it. Am I right? Pandian sir?
Sir, and sir, in this case, so
Hmm.
that case was consult. He went to a lot of big hospitals like Care, Apollo, everywhere he went. Most of the
Hmm.
topmost neurosurgeons and orthopedic also consulted him, and
Hmm.
nobody find out this. Your view is completely different. So in this case, if we treat
Uh,
this bradycardia, whether it will improve.
yeah, bradycardia has to be treated by removing the stress from the brain. You don't need to give him medicine for bradycardia, right?
So how to
There's an
treat that?
adrenaline crisis. So just put some needles here properly and stimulate. Topic over. So after 5 days, you will see there is no more in bradycardia. Brain is a factory of hormones. This is what I was saying, hormone regulation. That is why I took that case study over.
So what is
लिखो
the point
पॉइंट
for
लिखते
that?
जाओ. हाँ क्या नाम है वो, शिवानी जी मैडम,
Yes,
right?
sir.
Right, all these things, important things. Adrenaline crisis is created uh, by hormone regulations, which is done by hypothalamus, and that is where the adrenaline crisis is created. Here is where the place tachycardia and bradycardia is created. And then today I'll give you the points for bradycardia, acupuncture points for bradycardia. So when I give this acupuncture point for bradycardia, you must understand you are regulating the hypothalamus. And also you are working the genetic system. That is the important part which I have to teach you. The neural basis of acupuncture. Understand, Pandian sir? I'll give you the points. Don't worry. I'll give you the 12 points for bradycardia.
Thank you, sir.
And please don't take it to your ego, huh? Don't please. No one should take anything, any class discussion to your ego, right? Ego is the place which has no place in our brain. It is a place of hatredness. So it is when you go to Makkah Sharif, they say, whom do you throw the stone? You throw the stone on your ego. The Satan is your ego. It will never help you to regain your knowledge. You see, whatever I had, right? I started taking my classes. If I would have waited for this, what you called my digital board and all these things, up to now it is not installed, right? So when we would have started, when we would have thought, you see, today 6 hours I meditated and I was thinking to find a solution to a problem, that how will I integrate BNYS and uh, first physiotherapy, the colleges of physiotherapy, principals of the colleges, the neurosurgeons, the BNYS, BMS, BHMS principals together in one round table conference. I was just thinking how to do it. And it took 6 hours for me to find out a simple answer. Why don't I talk to one lady who's a dean of SDM college, who's very well known to me? I spoke to her and then she agreed. And we created the group. And then we created the group of with 7 principals and 7, 8 neurosurgeons. The more the institutions, the more you will help to create more people, principal head of and all these good people, the professors, you try to aid in this group. What will happen? We all can sit and discuss our problems which we are facing in our clinic. And then a good discussion can take place that this is how you can resolve it. The Ayurvedas will come with Ayurvedic formulas, the homeopaths will come with the homeopathic formulas. The physiotherapist will come with different activities of physiotherapy. And then how PNF can be integrated with NIBS, how this can be done with that, and that can be done by this. So today we come to know that yes, only in a chronic conditions you suffer from large number of situations. That is why a teamwork is required. And I'm very thankful to you, to Dr. Pandyan, that you thought me eligible to resolve this problem because you thought the surgeons who are renowned surgeons and renowned neurologists who could not resolve this issue because they always thought this as canal stenosis, right?
Yes, sir.
They never they never talk to the patient again and again. And in my case, I always talk to the patient. How are you? How are you? How are you? And sometimes patient becomes irritated. Why am I asking how are you? But whenever I speak to him, how are you? How are you? I see his tone, I analyze the frowning, the irritation, and then I understand what is anatomical approach. And then I said, okay, in a simple day, I'll clean the case. He's having bradycardia, he's having at times having tachycardia, he's having no blockages, his heart is functioning well. And fourth is what? The loss of nerve activity in the biceps area. Because of the loss of nerve activity, the nerve conduction, the amplitude reduction, what happened? The wasting of muscles have started. If he would have waited for one more year, he would have not been able to this build his what? What do you call this movement? शिवानी इस movement को क्या बोलते हैं?
Sir, elbow extension and elbow flexion.
Yeah. The most important part he would have lost is the movement above the elbow joint. He could not even flex it because these muscles have become weak. The contraction and relaxation of biceps have become weak. Triceps, which is primarily governed by C5, C6 area. So everyone was focusing on this what? Pregabalin and nortriptyline. You were focusing on nerve decompression, and I was focusing on what is the problem. Let me solve the problem. What the patient is saying, but let me hear that. He will keep changing his statements. I know, but let him change. What is the harm? Why should I be annoyed with the change of the statement? That is the choice of my patients. And then you see, now he'll start recovery. Next week, if you take his NCV, you will come to know how much improvement has come because the baseline marks are there. That is why in our clinic, it is one of the rarest clinic of in India where the interventional radiologist gives the injections. That's from Niemann's with the kind of ultrasound. I don't give any more injections. I allowed it to do it by the interventional radiologist. That is why I say, if you would have delayed this case and you have pushed this case, you would have destroyed one good life. And I really appreciate Pandyan. You have done a good work, not by referring the patient to me, but trying to resolve the issue. That is where we are good physicians, right? That is why it is called a good family, right? What is
Correct.
the time? I don't have the watch.
9:20.
Huh?
9:20, sir.
9:20, right. So our class is supposed to complete at 9:30. So before completing the class, we should understand the neural connections, the emotional processing, and the hormone regulations. All they have very much interconnections. So when you are angry, you try to raise your hand and you beat it with the full force. You speak all this, whatever you don't want to speak. And then, because of the high temperature inside the brain, there's a high chemical debris. Debris means unnecessary activity, and it destroys the neural connections inside the brain. That is why it is said, Kam, Krodh, Mat, Maya, Moh, Lobh. You should conquer all the eight evils of your brain. And that is where Quran said, where you have to raise the fatwa. Fatwa means you have to kill the evils of your own self. And you have to raise yourself higher level. And that is all what we are speaking about G lymphatic system. We are speaking about the lymphatic and the G lymphatic system altogether, right? So I have given too many information in the same time. I hope I was correct and there was no controversy in the information which I have given, right? So any controversial information did I convey?
No, sir.
Can
No,
you hear
sir.
me?
Yes,
Hmm?
sir.
Any controversy?
No.
Sir, points for bradycardia.
Huh? Points for?
Points for bradycardia.
That I like. I have a habit. See, whenever you tell me to write something, I have a habit. Like you, I start writing notes. So until I give the notes, why I have selected, what is the reason of selection? My stomach does not allow me to sleep. It will keep vomiting for the whole night. So I have made one habit of what? Keep writing, 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 and writing. Now, if you ask today, any from Indonesia was asking me, sir, what is the point for CP? So I must be eligible to express why I have selected this point. I just cannot say, I have selected this blah blah black sheep. Have you any wool? Yes, sir, three blacks full. Yes, I must be explained. I have three blacks full. One for my mother, one for my, I forgot.
One
Shivani, क्या
for
है?
my master, master.
One
One
for
for
my
my
master,
master.
one for my Dane, and one for the little girl who's swinging on the way, right? I think I remember that much only. I don't have children, so I remember Baba Black Sheep in that way. Long back, I heard this poem. Now you see, this is where the creativity of the children are going. You see, these children are so creative. You put a information at them and allow their mind to grow. That's what we did. We stopped their mind from growing. Our whole education system was created of a clerical system. We did not create a system where intelligence can be grown, right? So, to make yourself intelligent, the best thing I have learned during my UPSC examination is keep writing, 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 writing. So, whenever I try to speak, when I go to this workshop, I don't use any notes. I don't do presentations. I just to try to give example as much as I can. I keep revising myself every day, every moment, everything, every day. The global pallidus, oh, it is in the hypothalamus, in the thalamus. So in thalamus, you got the hypothalamus, the global pallidus, the substantia nigra, the putamen, all these are there. So Parkinson's come from where? Hypothalamus, right? Am I right or wrong?
Right, Jay.
Huh?
I do the Parkinson hypothalamus point. You
Now,
you
can you tell me which is the hypothalamus point? How did you come to know that that's a
uh,
hypothalamus point?
hypothalamus means motor part, sensory part. Then uh,
See, Murgaya, the
yes,
problem with
yes,
you,
Jay.
Murgaya, one thing I tell you.
Yes, yes.
From where these points came out? What is the scientific explanation? They are just following the geosulfa scalp.
Yeah, not skull. NAPS.
In
Not
NIBS, I never taught NIBS non-invasive brain stimulation is my brainchild. I never told about the thalamus point and the hypothalamus
I
point to
I
them.
learn your learn as a teacher, professor
I never
to
wrote about this,
engage
so I don't know.
engage.
I don't know from where did MK Sastry
No,
speak.
no,
Still, I
no.
did not spoke. You are
Yes,
one step ahead of MK Sastry technique. Huh?
no, to myself
It's okay.
as a Guruji.
It's
That
okay.
I learned more.
See, everyone has his own opportunity to enhance his experience. You have found out something new. We also like to understand what you have learned. But over the internet, let me speak because people are hearing to you. All have united to hear me, right? So you may ask me your questions.
Sir,
इमरान
good
बच्ची का
evening, sir.
होमवर्क हो गया? इमरान बच्ची का होमवर्क हो गया? बाबा लक्ष्य पढ़ा दिया? इमरान मुस्तफा they think I don't know anything what is going in your house. I know very well. I am MK Sastry. It's very difficult to focus as a father to as a mother to a child to a daughter. Variety of roles, variety of things, and then bearing MK Shastri, another big headache. ah, please ask me a question, please.
Sir, the point for adrenaline crisis, hypothalamus, and bradycardia.
See, I'll just give today one point, right? Bradycardia. But whenever there's a bradycardia, just go for the 2D echo and everything. Rule out. What is the problem? Bradycardia is not a good situation, right? Whether tachycardia is a good situation, nor bradycardia is a good situation. Since there was a medicine doctor and there was a radiologist, both sat together and evaluated the case, so I'm stress free. Otherwise, I would have get another stress in my brain. And you see, all these investigations, all this treatment, 5 physician care, he got in just 40,000 rupees for 1 month. 2D echo, NCV test, and what you call injections, blocks, orthopedic care, neurosurgical care, all you got is just less than 40,000 per month, which is 1 day bill in a hospital with continuous physiotherapy, IV medications, everything you got at a cheapest price. If I am admitted in a hospital, I will also not get that much price. इमरान बच्ची को होमवर्क दे दिया पढ़ा दिया इमरान मुस्तफा देखा ओ एक फोटो खींच के रख दिया ऐसा लग रहा है क्लास अटेंड कर रहा है इसको बोलता है प्रॉक्सी anyway ask me your questions please. You have liberty to ask whatever you want to ask, but don't ask about my marriage, okay? I'm not a married person. See, whatever you want to do, you can do. Who am I to stop you? Right? Am I right, Shivani? Who am I to stop you? Do whatever you like. He is asking me, can I do NIBS without using this or that? You do whatever you like. Who am I to stop you?
Everyone has the liberty to do anything,
Yeah,
whatever they want.
yes, whatever they want. It's because Surendra Patil wanted to practice what he got Jews can and Mohi Bichari died. She was the best person. She used to be very angry with me. MK Sastry, get out from the class in Jews can. So after the death of Moy, I'm missing her company because whenever you tell Moy about MK Sastry, she used to scold people. So Patil wasted 2-3 lakh rupees on his course. I said, what is the use of wasting money here and there? But it is required, until you get thoroughly research, when you understand what is right. Then after learning things, you come to know. After burning hands, you come to know what is right and what is wrong.
Yes.
Until you burn your hands, how will you know? My hands are not to be burned.
Yes, Shastri ji, sir.
Tell me, please.
Yeah, I'm Chandran.
Tell me.
So, yeah, myself and Sachin Pawar planning to come to Hyderabad if you permit us to learn.
My only thing is that, see, I never restricted anyone from coming, right?
Okay, sir.
In my life, only my problem is, I always pray that the moment you come, you should not become like Sunil Kumar. The moment I came, I was in ICU. So that should not happen. Otherwise, I never restrict anyone from coming. But I
What
made
about,
one rule this time. What are the
okay, what
rules we have
is
selected?
Sunday, sir?
So our rules are very simple. Those who have 7 pens,
Yeah,
they should come to this class.
yes, sir. He
And
bought already 7. I bought 4,
uh,
and another 3 I will buy.
you buy from Sandeep and finish that off.
Yeah, okay, right.
See, the question is that when I am teaching, you must be able to practice,
Okay,
right?
right. Okay.
Because if I
Shall we
give
plan
certain
on check?
formulas, right, we have to we cannot go in a very strong manner. We cannot go with all these things, right?
Okay.
We have to
So
adopt a lot of shortcut formulas.
okay.
When is
Shall
a
we plan
shortcut?
next Saturday, Sunday, sir?
Yeah, it is 8, 9, 10.
8, 9, 10. That
Yeah.
is not next Saturday.
I don't know what it is, please, sir. I just
Okay.
found 8, 9, 10. I'm free. I did not see the calendar. I saw 8, 9, 10 topic over.
Okay. All right. Okay. I will discuss with Sachin Pawar and contact you.
Yeah, you can
Thank
discuss. You all
thank
are most welcome. Everyone is welcome to my house.
you. Okay. Thank you.
I never stop anyone from coming, right? I only feel very bad that after learning, there's lot of ego issues in your brain, lot of angerness, frustration. So to dissolve all these matters, I made the things very simple, right?
Okay.
Regular classes to streamline the subjects, to bring the neurosurgeons in your touch, to bring the neurologists from America and other universities in your touch, right? So that you can be taught by the finest faculties. Then you can be taught yoga. What is the implications of yoga in your life? Then how yoga implicates the cleaning and cooling of the brain. What is the importance of Nam Japa or Jakir? And all these things you will understand. When you understand the importance of all these things in your life, then it's always a saying, the more you love the someone asked me how to love God. I said it is just like a mobile phone. The more you know about the features, the more the features you got attached, the more you will love the mobile phone.
You are true, sir.
So the more you know about the features of the pain, the more you know about the mapping of the patients, the more you are able to recover, the more you are motivated. The more you are motivated, the more you will achieve, the more you will achieve, the more you will grow. I always remember there's a person from Hyderabad, Bangalore, Avinash. He was just a medical representative, right? 4 years back when he came to my room and he said, I am a medical representative. The first thing what I did, you know what is? Oh God, another headache to my head. But then his approach
Yeah.
was very good. And I said, okay, the headache has come. Let me take that headache. I always believe God has a final purpose. And that boy has gone to a multi-specialty hospital and become an acupuncture consultant. There were
Yeah, we
seven
met him in Bangalore.
acupuncturists there were seven acupuncturists who came to his competition, but he was able to pass that while giving his presentation, and he became acupuncture consultant in a good multi-specialty hospital in Bangalore. I always told him, have patience, do good, and you'll achieve the best. I'm very happy that he has developed 10 new patients in the new hospital without the hospital support, and 10 new patients in his other hospital. So now he's working in two hospitals. Then he will start working in three hospitals. Two, 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 two. I always tell the people, one patient should be treated for 2 to 3 days. Then other place, then other place, then other place. Why? Because if the one person tells you to go out from the first place, second two are there. It has happened with all the physicians. Tomorrow morning you go to a super specialty hospital, and in the morning the neurosurgeon will, the CEO of the hospital will come, the marketing GM will come and say, your services are no more required. You can leave the hospital. So we have all faced this because your targets are not fulfilled. These are the issues. These are the darker parts, but then let us not discuss. This is not the platform to discuss the darker parts. This is a platform where we should discuss all good things of the world, because by now we are all tired, harassed, frustrated, scolded. So when I come in the class, we come with the same mood. So we all should go out of the class, not being scolded, not being frustrated, with a smile, with a beauty. And the first thing I'll advise, Surya Narayan Das, go and kiss your wife. And one good point I am going to tell you. So take one photograph of you sitting like Imran Mustafa and put it in the what? Uh, as a proxy picture. So now I'm not moving. Okay. So for 1 hour I'm not moving. I'm in the home atmosphere. The picture is there. So we say, oh, he is there. Oh, he is there. So, so there is a very good way of giving proxy. But after giving proxy, you are getting proxy. Proxy means what? After giving proxy, you are getting proxy. Proxy means what? Imran, what do you mean by proxy? Huh? What do you mean by proxy? It's a very good term in medical science. What do you mean by proxy?
Proxy. प्रॉक्सी क्या होता है?
प्रॉक्सी क्या होता है बताओ?
So is it toxin?
আমি একটা ব্লগিং করতে
Proxy is a medical, in medical science, we call it what? Proxy. So if I teach you something and day after tomorrow, what you will do? Two lines from here, two lines from there, and two lines from today. You make 6 line paragraph, which is what? Proxy. Proxy means something a new creation. Like Murgaya practice. I never taught about what you call hypothalamus point or pituitary point or all these things. I never teach, right? I never
No,
teach.
sir. No, sir.
I never
I,
teach.
no, no.
But I'm not saying you are wrong. I'm not saying you are wrong. I'm saying about
Uh,
myself. What you may be
no,
doing,
no.
you're correct.
You are the best teacher.
No, 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 no.
I am one of the lad.
Whatever I am, let it be. But I am saying that I did not teach this point. So it is his experience and he found out those points. That is your credit, right? But if you ask me, did I
I am
teach all
such
these things?
someone.
Radu. In Telugu, we call it Radu. Radu means,
Grandfather.
huh?
Grand
Radu means what?
grandfather.
No way.
No way.
This no.
No means no. Radu. You can ask your questions. I put up myself on the floor to ask your questions.
सर
इमरान कैमरा का पोजीशनिंग अच्छा से करो नहीं तो लोग बोलेगा तुम प्रेग्नेंट है. हाँ, अपना हंसता हुआ चेहरा दिखाओ. तुम नहीं तो सबको बोलेगा प्रेगनेंसी चल रहा है. 8वां 9वां महीना चल रहा है. इमरान दीदी की जगह लेके आ गए. Tell me your questions, please. Put up your questions. Yes. Just take all my jokes in the light mode. These are just light mode jokes, right?
सर
I don't want to be a serious teacher. And I was never to be known as a serious teacher. I just like to be a common man. And when I was on ventilator, I just was happy that if I die, I die like a common man.
सर हेलो सर
Yes, yes. Please tell me.
सर सुनील बोल रहा हूँ
Ask your question. Ask your question, please.
सर
Hmm.
एडीएचडी और एपिलेप्टिक सीजर आते हो तो उसके लिए अपने पेन का कौन सा प्रोटोकॉल यूज कर सकते हैं
ये तो सारा झमेला वाला काम है. एपिजिप्सी और ये एडीएचडी. अभी नो एपिलिप्टिक ड्रग खा रहा. कौन सा एपिलिप्टी है? फोकल
सर
सीजर है, टॉन क्लोनिक है, कौन सा है?
टोनिक
एब्सेंट
क्लोनिक
है, कौन सा है? टॉनिक क्लोनिक. इट बिकम्स लाइक दिस.
यस सर
ठीक. कब से है?
सर 6 साल की बच्ची है 5 साल की
हो गई आफत. बचपन से फेनेटोइन दे दे के बर्बाद कर दिया कर. See, this type of seizures they happen in this child because of lesions inside the brain, right?
यस सर
So whenever we speak about this type of lesions, it's the most corrective procedure is to recover them through epileptic surgery. And the outcome is very good. And to manage it, it is 2467. Second finger. 2467. 2467. Second finger. ADHD. So when you are using 2, you should use the second pen. When you are using 4, 6, and 7. Since you have the ninth one, you can use work with the cerebellum. So it will, when you approach the cerebellum, it will also help you to work with the hypothalamus and the
Yes.
hormone regulations, and you can bring some control in the seizures of the patient.
So special pen 2 वाला.
हाँ, स्पेशल टू, वेरी करेक्ट. क्या बात है, आजकल तो गिदड़ों में भी वो आ गई, आवाज आ गई. हाँ.
आवाज आएगी. आपका आशीर्वाद है सर.
एक ये था जो क्लास में कुछ भी नहीं बोलता था, यूं बस चुपचाप नमन के पीछे घूमता रहता था. अब ये देखो शेरों की तरह दहाड़ता है. ही वॉक्स लाइक ए लायन.
सर अभी भी चैट में पहले क्वेश्चन लिखा है, फिर सुनील सर ने पूछा है हिम्मत करके कि सर चैट तो देख नहीं रहे, तो बेटर है पूछ लिया जाए.
अच्छा, लिखा है क्या?
यस सर.
अरे आई एम वेरी सॉरी, मैं ये चैट बॉक्स खोलता नहीं. बाबा, hemorrhagic, this I don't deal with. Cancer hemorrhages. There may be various sepsis at various levels. So acupuncture was never made for this recovery. क्योंकि the most important is whether the patient is on antiplatelet therapy, what kind of chemo drugs are given, what kind of stage he is suffering, staging, classifications, drug, detailing. We call cancer profiling is required in these cases. So, Baba, I'm not in a position to speak. I'm not the master of all. I have my limited knowledge with limited subject, and whatever I am doing, I should be good in that.
Sir, good, sir, good thought uh, to combine all therapies in one roof.
Yeah, it is very important, Kalaji. See, I have always seen homeopathy is very good, allopathy is
Yes,
very good, physiotherapy
yes,
is very good, occupational therapy is very good. But we have followed the traditional syllabus. We have not come up with new things.
yes, sir. Every therapy has their limitations and their expertise. That's why I think all therapies has something good. I mean, some
Yes, everything is good. Now we have to think adding of things. I'm fond of Ayurveda. I'm fond of homeopathy. I'm fond of allopathy. I'm fond of, I don't know about Unani, but I'm fond of all these good herbs and all.
physiotherapy, yoga. Yes, sir.
I'm very good, fond of yoga. I'm very good fond of this bhakti yoga.
Yes.
I like all these subjects. So I
Yes,
just thought in my mind, why when I like all this, why not I bring everyone to like all these subjects together?
really, sir. Great thought. And that
But I
works,
don't
sir.
have the phone
Yes,
numbers. So I request you to collect me all the numbers and phone numbers of your professors, talk to them, and
yes,
get
sir.
associated with the best neurosurgeons of the world. We are going to get associated with Muhammad Reza Abbasi, Varun Agarwal, who's the chairman of the medical college, Ayub Cherian, Charlie Teo.
Yes, sir. One doctor is there, a Vishwadubra Chaudhary. I heard about him. He is also combining all therapies to treat in their
Who?
center.
Who?
Vishwadubra Chaudhary. Vishwadubra Chaudhary.
Ah, I may not know
He's
about him.
also combining so many therapies in one roof in
See,
their
I do
hospital.
not know much about him, but so far I am concerned, we have not combined a lot of things. See, first of all, we'll have a epilepsy classes, right? Once we have epilepsy classes, how epilepsy occurs, what epilepsy occurs, we have not reached that level.
Hmm.
So when we go to that, we'll go for that lecture in details, right?
Yes.
Keeping answers from here to there and there to here and running like I have to go to coach number 2 and then 2 to 7, 7 to 5, 5 to 6. I don't think so we'll reach anywhere. My train will run away. Where is my coach number? Arre bhaiya, we are in coach number 2. So let us complete coach number 2 nicely.
Yes.
More questions? So all those who are without webcam, all the attendance is cancelled. Right. Now opening is no use. Your attendance is cancelled. Who knows what you are doing behind the camera? You are dancing, you are eating, you are doing Bharatnatyam, Kathakali. We don't know what you are doing. Only smiling faces will have their screenshot, right? Rest, tata, bye bye, see you. So see, there is a course on it. This what you called Ramalingam from क्या नाम है? I don't know. पंडित जी, डॉक्टर Madhav Rao Pandit.
Yes, sir.
I wish you very much
Madhava Pandit.
congratulations on
Yes, sir.
completing your fellowship in preventive cardiology. It's a
Chalo, sir.
very good subject you have
Yeah, ma'am.
selected.
Yeah, sir.
Yeah. I've completed my
Yes, sir.
7 fellowships.
Thanks, sir.
I'm on the verge of completing my 8 on movement and epileptic on movement disorders. Then I'm completing my epileptic disorders.
Oh,
I've completed
very
my
nice,
7
sir.
fellowships. So this will be my 8th one. 8th or 9th. 9, 2 more I'm completing.
Sir,
Very nice.
sir,
There's a beauty of the subject. After completing all of these things, and when a patient comes, we are helpless. And then we speak, very sorry. In 2 minutes, all the ego is scattered. We ventilate the patient, we try our level best, and then we see the patient coming and dying. And then we say, our ego is scattered. No use of talking about the ego. We take bold decisions, we burn our hands, and after that we learn this was our ego.
yes, sir.
And that is why I say there is nothing called gut feeling. Gut has to go in the morning and flush in the washroom. So this is my strong appeal to all the physiotherapists and all. Whoever professors, whoever principals you know, whoever good person you know, please put their names in the to my DM or personally put me so that we can add all these good people in the WhatsApp group and we can have a joint table conference.
Okay, sir.
I am planning to have a round table conference. So that
Yes, sir.
at least everyone come and speak what they are doing.
Sir,
So when
one
someone
doubt, sir.
asks, tell me, Pandian sir.
Uh, Sir, for beginners, it is which one is easy to treat, sir? It's a infarct stroke or a hemorrhagic stroke?
See, everything is easy to treat. It is only up to you what way you have treated it. Never think one thing in your mind, something is difficult to be treated. The lack of information is the creation of fear. The moment you are informed, the fear is gone.
So the healing will be same for both the conditions with the brain mapping system, right, sir?
Yeah, it will help. See, conditioning is not only about the stroke, right? It is about what has happened inside the physical damage inside the body. So the physical recovery also. It's not about just putting needle and recovery. It is to bring the conductivity, which area is weak, which area is strong. Bringing equilibrium in the muscles, bringing complicated movements is the ultimate solution. So brain mapping is one of the most strongest path. This is what we were taught while we were doing what you call uh, fellowship in live navigation transmagnetic stimulation, LVMTCM.
Thank you, sir.
It is one of the powerful tools, not the only tool. You have to use physiotherapy, you have to use conservative medications, you have to use everything. But don't do massage. খাইরুল ঘুম নিতে আসো। ঘুম নিয়েছি ক্লাসে, একটু বসে ক্লাস থাকো। খাইরুল is sleeping in the class, you see. Ask questions. Imran is
Manic
sitting.
conditions में
Tell me.
सर मैनिक कंडीशन में तो पागलपन में कितना असर करता है अपने शरीर में?
किस तरह का पागलपन है वो डिपेंड करता है, घर का माहौल कैसा है
फिर
नहीं नहीं नहीं
कुछ
नहीं नहीं नहीं, कोई भी चीज के ऊपर कुछ भी नहीं बोल सकते। हम लोग बहुत बड़ी बड़ी बातें करते हैं, पर जब टेबल पे आते हैं तब कुछ नहीं बोल सकते। मैकेनिकली हम लोग ये बोल सकते हैं, साला ब्लॉक है, स्टंटिंग लगा दो। स्टंट लगा दिया, ये हो गया, ये दवाई दे दिया, टॉपिक ओवर। बट अगर आप ध्यान से देखो, सारी बातों को ठीक से समझो, तो एक बात समझ में आती है कि भाई प्रिवेंशन इज ऑलवेज बेटर देन क्योर। I always see Dr. Aipted in getting up early in the morning at 3 or 4 o'clock and doing his yoga at 5 o'clock. And he walks very nicely. He speaks about the basics. He never speaks about high-fi things. तो सबसे अच्छी बात ये है कि बेसिक्स को ठीक करते जाओ ना। जब बेसिक्स ठीक हो जाएगा तो फिर तो सब कुछ ठीक हो गया। आज आपको आज आप पेन खरीदने में क्यों हिचकिचा रहे हो, आप कुछ करने में क्यों हिचकिचा रहे हो, बताओ? बिकॉज योर बेसिक्स आर नॉट स्ट्रॉन्ग। You never spend a time with neuroanatomy. You never spend time for all these things. While some people are doing magic, some people are still there. I've always given so many articles, so many things. RTCM mapping, all these things are there. Go and search in scholar.google.com. What is your favorite topic? You'll get a lot of abstracts.
Okay.
Rather than asking me, you can go and study yourself. Day before yesterday only I gave about brain mapping and NIBS and references. I gave, I think, right?
In that website.
In WhatsApp group, I have given point wise.
Brain mapping.
Yes, yeah, about brain mapping. I think I have given, right?
Yes, yes.
Okay.
Today I have
Hello,
given about
sir.
the CP point. Tell me, please, from Nigeria.
From Nigeria, sir.
Noami.
Yeah.
Noami, tell me, please. Please
Yeah.
tell me. Noami.
The other two special pains that you are talking about, on which area of the brain when it comes to treatment, sir?
Right now, no.
Because-
Right now, you also don't
Okay,
have the
sir.
pain, nor I have the ability to send the pain from Nigeria. The orders from Nigeria is pending from last 1 year. So let us not discuss on this too.
Okay, because we purchased the other pens, sir. The other
You
6
purchased
pens
the
we
order.
have.
Yeah. You have 6
But
pens.
yes, but the other 2 special pens that you are talking about,
then-
that's what I'm asking.
Okay, we will find out the way. While we take this class, we'll give you some special notes, right? So
Okay, sir.
those who are coming, Pandian and all those who will be coming to this class, they'll be having the opportunity of learning in depth about the brain.
All right, sir. Thank you, sir.
They'll map the map, and a lot of notes are with Shivani, right? Shivani Walia. Shivani?
Okay, sir.
Shivani, are you there, beta?
Yes, sir. Yes, sir.
Shivani?
Sir, I have already shared in both all
Shivani?
3 books. Yes, sir.
Are you calling
beta,
Valit or you
सबको
are calling her, sir?
yeah. Shivani, you can give them the notes again, right? Repeat the notes. ये notes को वापस उस notes में मिला के notes दे दो, right?
ठीक है, sir.
Okay,
So,
sir.
Naomi, you will have a lot of brain mapping with the note.
Okay, thank you so much, sir. Thank
Sir,
you, madam.
No, there is
is
nothing to be
it?
thankful. It is
I've
Thank
our
you,
already
Dr.
duty.
shared
Shivani.
in the group.
वापस वापस शेयर कर दो ना, क्या प्रॉब्लम है? जो अब नया लिखा उसको जोड़ के वापस शेयर कर दो, प्रॉब्लम क्या है?
ओके ओके सर, ये है ग्रुप में यहाँ पे? हाँ हाँ
Naomi, you are in
ठीक
the
है, ये
group?
सर ग्रुप में है व्हाट्सएप ग्रुप में
Yes, sir,
हमारे?
I am. I am on the
ओके
WhatsApp group, sir.
मैं I will
Which
share it
group? Which
again.
group you are? Which group you are?
The almost in all the groups, sir.
Arey, we
Okay,
have
I will
75 groups. We
share
have
it again.
75 groups.
Okay.
I
Um,
think
Yes, 75
most
groups.
the
You don't know
recent
which your
one
group.
is
yes, I wouldn't know because I'm into many of the groups you've opened, sir.
I
So
will
you be in
share in
MKS
the
class or fellowship
neuroactive
class?
webinar.
Oh, okay.
You
Okay,
go in
I
the
will
fellowship?
check.
Okay,
Yeah.
Thank you.
I will share it. Okay.
Thank you, Dr. Shivani. Thank you. I'm grateful.
She is grateful. See, the knowledge from Noida to Nigeria has come in 1 minute. Huh? So easy.
Thank you so much, sir.
And
Thank you.
the Gurgaon, Noida, Nigeria, all have integrated. This is called what? Integration of various frequencies at various levels. Right?
Thank you.
You imagine this journey was started with only 4 students in the class, right? We never know this will go in a so long way. And definitely it's a very good enjoyment talking to you all every day. And I always call it meta jalab dose. So after talking to you, my stress comes down. So I'm very happy that I can talk to you. Every day you people come, so yeah, it's very smiling face, and you try
And
your level best to understand what I'm speaking about, all your clinical hectic schedule, everything you mesh up, and then you come to my class. And I really feel very guilty. Sometimes I'm late in the class. I take a lot of your time. But on the other way, I express my deep gratitude to all of you people, that you all have done wonderful job. And you will be doing really wonderful job to the society. And that is called the legacy which we leave behind. Legacy is not created in days or months. Let it continue in the way it is, can be created. Today or tomorrow, you see, Sivani, when you started the journey, you understood nothing. But you see, today when Naomi is asking, you are very confident to speak what you want to speak. Each step makes your knowledge more clear, and the other step makes it more brighter. And the fourth steps make you more closer. So each step is a beautiful step of your life. Never regret, never repent. Be happy in the way we think it to be way, in the best way we can. It is always my first approach. Whenever there is a critical case, don't try to resolve it yourself. Sunil, it is always better you refer the patient to Nikunj.
Okay, sir.
अंकित का नंबर होगा ना, अंकित अवाना का,
Yes, sir.
तो उसको निकुंज के पास भेज दो. निकुंज इज अ वेरी गुड न्यूरोसर्जन फ्रॉम सीएमसी वेलर, very nice person, down to earth,
Okay, sir.
and very good epileptic surgeon also. हमको मालूम है लोग डरते हैं, इसलिए that is why I created my what you called nation campaign. So after some time you will see me, I am in Madras, Bangalore, giving talks at various institutions to remove fear in the mind of the people that neurosurgery is not always a wrong deficit. Selection of the speech surgeon, the selection of the treatment, the procedure, if it is all correct, the outcome is always correct. The wrong delay in the treatment, delay in the surgery is always wrong. For example, if you put this 5-year-old girl for 10 years on anti-epileptic drug, what will happen to this child? Her life is spoiled. Whether if you operate and recover it, the life becomes easy. It is our duty how to explain them. The more the communication level will become, the more we become, and we openly speak. We will only speak of what we are going to do and the creation of a better society. No doubt this will help what I have said. But ultimately, she has to come out. She has to live a very good life without the support of any anti-epileptic drugs. And I tell you, epileptic surgeries are one of the most beautiful surgeries which can be performed by the best neurosurgeon. Sai Chitra, Neiman, Hyperion, they are all very good epileptic surgeons. Marvelous. Dr. Pandian. Note this Pandian. Selva Pandian in Kim's Karat. Selva Pandian. So, more questions, please.
Sir, is it okay to continue the epileptic drugs for a long duration?
Yes, questions, please.
Sir, one question, sir. Is it okay to continue the epileptic drug for a long
ये
duration?
वो क्या बोल रहा है मैं समझा नहीं. I did not understand what he spoke. What did
Sir,
you
am I
speak?
audible? Sir, am I audible? Sir, my question is,
You are
is it
not audible to me. Anyone कोई सुनाई दे रहा है किसी को इसकी बात?
सर इपिलेप्टिक ड्रग कंटिन्यू दे सकते हैं क्या, ऐसा पूछे?
एंटी एपिलेप्टिक ड्रग क्या बोल रहे हैं काला जी?
हाँ जी, वही एंटी इपिलेप्टिक कंटिन्यू दे सकते हैं क्या लंबे समय तक?
नहीं देखा, एंटी एपिलेप्टिक ड्रग्स आर ऑलवेज गिवन इन लॉन्ग ड्यूरेशन, right? It is given for a period of 3 years. So if your period of 3 years is anti-epileptic, means you don't have any seizures, then you continue it for, you taper it and you close it. But in hardly few cases we found that drug overdose is always the outcome. You destroy the gut, you destroy the liver, and you destroy everything. You destroy the cognitive features of the brain. You destroy the growth pattern of the brain by all giving is uh, GABA receptors like gabapentin, pregabalin, all these anti-epileptic drugs. So even if you give anti-epileptic drugs for sciatica pain, it's not good for health. Up to certain time it is okay, but after certain times it is not.
Okay.
So we have to find out the problem and solve it.
Okay.
so? It is not good to continue the anti-epileptic drug, correct, sir?
But then you cannot have any solutions to it. If there's a long time seizures and if the seizures are not controlled, you may lose the patient. He may go in complete impairment, functional impairment. He may have epilepsy, he may have paralysis, he may have anything. It's an involuntary impulse of the brain. It is never good. The source has to be recovered, the anatomical source and the cause of the disease is recovered. So once you do it, I'm very sure the success stories are there.
Okay.
See, lifestyle changes now in a 7-year-old disease child or 5-year-old child. What lifestyle you will correct in that? Food habits you can correct, all these things you are correct. But what about the lesions inside the brain? How will you recover it? So before giving an opinion, I always tell that please analyze what opinion you are giving. Because everyone in the group is very studious. Dr. Madhav Rao Pandit is a MBBS doctor who has done his preventive cardiology. All are very qualified people here, right? So whenever you give an opinion to a second party, Ramanujan Pandian is a very good homeopathy doctor. Hmm? So all these are qualified people. They are all. Alpana is a PhD in pharmacology. There are two neurosurgeons sitting in the group very silently.
Oh.
So before you give any opinion, you have right to ask the question. But when you give an opinion, you have to be very careful with what opinion you are giving.
True, sir. सही बात.
आप कुछ भी देने से ओपिनियन देने से पहले एक बार सोचो तो सही आप क्या बोलना चाहते हैं.
सही बात है, sir.
आप हवा में उठा के कुछ भी ओपिनियन दे दोगे, चलो हम लोग को तो मालूम है ये ओपिनियन ठीक है, बट किस कॉन्टेस्ट में आप दे रहे हो, किसको दे रहे हो, किस सवालों के जवाब में ओपिनियन दे रहे हो. We're professionals. You cannot just come up and give something and you can go. It's not a parliament of India. अब कुछ भी आ जाओगे, कुछ भी बोल जाओगे, ऐसे थोड़ी ना होता है. It's not a conversation of what you called conversation of uh, bar association. कोनार में जाके कुछ भी बोल जाओ, ऐसा नहीं है. It's a conversation which has to be taken in a very polite and very nice manner. It has to go in a very courteous manner. Because the recordings are seen by the people, right? That is why I encourage you should ask questions. It should not be like it's not fear for asking, but always be careful while you give your opinion. पूछने में कोई सवाल, पूछने में कोई प्रॉब्लम नहीं है, और अपना ओपिनियन भी दो आप, पर एक बार देने से पहले सोचो आप किसको दे रहे हो, क्या दे रहे हो, और किस फैक्ट्स के ऊपर, किस आधार पर दे रहे हो. व्हाट आर द फैक्ट्स बिहाइंड द ओपिनियन यू हैव क्रिएटेड, राइट? हवा में आके कुछ भी दे देना सही नहीं.
सही.
ये मेरा मानना है, बाकी आप कुछ भी करो, मुझे क्या फर्क. यू कैन डू
Sir,
व्हाटएवर यू लाइक.
sir, I asked as a question only, sir. It's not my
No, I'm
opinion.
not saying about the opinion. I'm just saying a general line of contest. I'm not saying about you particularly, right? Don't take on your personal basis. I'm just saying that whenever you give your opinion to a patient or anyone, right? It's a general
Because
contest. It's a
one
general
of
thing,
my
right? I'm just saying
my
a general thing, right? Because whenever you give an opinion, this opinion is goes to the market. It's just like the judgment of the court. So until the judgment is given, it is reserved to the judge. But when he gives a judgment, it becomes a public property. So it will be criticized, it will be subject to uh, citations, it will be subject to the part of various court orders. It is a part of public property. It is not a private property anymore. So when you give an opinion, when I take a class, it is a public property now. Whatever I spoke is a public property. You know? It's a public property. So whenever you
sir,
give something on public, you must be aware that you are giving a public property. नहीं तो मुस्तफा जी की जगह बिरयानी खाना पड़ेगा. इमरान जी देखो बिरयानी खा खा के हम लोग को कुछ भी नहीं देता है. इमरान जी का काम ठीक है, एक फोटो खींच के लगा दो. फिर थोड़ी देर बाद प्रॉक्सी मारना सीखो तो इमरान से सीखो. और इमरान से हम प्रॉक्सी मारना सीख जाएगा. मैं क्या करेगा, लेक्चर बैकग्राउंड में रिकॉर्ड करके अपना चेहरा को ऐसे ऐसे करके रख देगा, थोड़ा थोड़ा देर में चेहरा हिलता रहेगा और वो बैकग्राउंड में सब कुछ. इमरान का काम ठीक, फोटो खींच के लगा दो, चिपका दो, फिर जब क्लास में बात आए तो हंसता हुआ चेहरा दिखाता है, ही है ना. नंबर वन प्रॉक्सी मास्टर ऑफ द क्लास, बैक बेंचर इमरान मुस्तफा. So my first advice to all of you is that let us create awareness in the society. Let us associate Bengal with Karat, Karat with Bengal. Let us associate Assam with Karat, and all good places, Ayurvedic, homeopathic colleges with each other. sitting together. Let the neurosurgeons take classes in the Ayurvedic colleges. Let the neurosurgeons take classes in homeopathy classes, right? Let them get the exposure of neurosurgery. Let them get exposure of everything. This is what I feel. When you get exposure, you will be able to understand what is the depth of the subject. देखो इमरान जी ने फिर एक फोटो हंसती हुई खींच के चिपका दी। अब आपको कैसे पता चलेगा इमरान जी पिक्चर में या फोटो में है? देखिए एकदम मोशन मोशन हुआ एकदम नहीं। फिर जब आवाज सुनाई देगा तो मोशन आ जाएगा, गला हिलेगा, फिर मोशनलेस हो जाएगा, इनकी आंखें भी नहीं खुलेगी। इनका नाम ही निकाल दिया, प्रॉक्सी मास्टर ऑफ द क्लास। I think I know Imran for many years, right? This time, every time when I was in Assam, since I was in Assam, he knows me, I think, Imran. Right, Imran? Am I right, Imran? See, class 9, Suryanayan Das, সেটা আমি জানি তো, ব্যাক বেঞ্চারে আমি সব জানি, কিছু বুঝলে বলবো না। Maghoy. I said, I know the characteristics of the backbenchers. Huh? So, any questions you want to ask? Last question of the day. So you'll get 12 acupuncture points for bradycardia, right? Anxiety, neurosis, and bradycardia.
I have a question, sir.
Majamin,
Hello,
your
sir.
voice is cutting down. Naza, yes, from Nigeria, yes. Naomi, tell me. Naomi,
Yes,
yeah.
Naomi.
Yeah, tell me. Yeah, Naomi.
Yesterday,
I know your voice.
yesterday in the course of your lecture, sir, you made mention that, you made mention that women die more than men in the aspect of stroke.
क्या बोल रहा है
Why
समझो?
is it so?
What she is saying, I did not understand. Majamin, क्या बोल रही है? मैं नहीं समझा.
हाँ, वो कह रहे हैं कि women die more in the stroke than men. Stroke से
Than men.
ज्यादा मरती हैं.
क्या बोल रहा है? मैं नहीं समझ पा रहा. इंटरनेट कनेक्शन खराब है. बताइए प्लीज.
Sir, yesterday's class you said women die more in paralytic attacks than compared to men. She's asking that.
See, there are some gender analysis based on some research papers, right? We have not made the gender analysis of the topic. These are published studies, right? So we have cited some published studies which have been made. These are small studies in the small group of studies they have made. But these are from published studies we come to know that this type of attacks are found more in female than in male. This type of attacks are found more in male than in female. Because of the inherent physiological quality of the place, the genetic influences, and the emotional approach of the patient.
Okay, thank you, sir.
It is not my
Thank you so
opinion,
much.
right? It is a published opinion, right?
Okay, sir.
It's a published opinion.
Thank you, sir.
ठीक है?
Yes, sir. Thank you.
So anyone wants to ask me any questions? So thank you so much. What is our time?
10:20.
Huh?
10:20, sir.
कल से 10 बजे तक क्लास खत्म करने की कोशिश करेंगे, राइट? द मोमेंट इट इज 10 o'clock, प्लीज लेट मी नो. 9:20, 9:30 we'll complete the class. 9:30 to 10 o'clock we'll keep for question answers, right? And discussions. Then 9:30 to 9:45. Because everyone is feeling sleepy, everyone wants to go to room, everyone is activities, right? So I thank all of you. I oblige to all of you. Bismillahirrahmanirrahim.
Namaste, sir.
May God bless you. May God bless each one of you. May Jagannath.
Thank you, sir.
Jagannath Prabhu सबने कृपा रखे. जय जगन्नाथ.
Thank you, sir. Bye, sir.
Thank you so much, sir.
Thank you, all of you. I'm really happy to see all of you in the class.
Thank you,
I'm really
everyone.
obliged and thankful to each
you,
one of
sir.
you.
Thank you.
I express my
Have
deep
a
gratitude.
blessed evening.
Thank you, everyone.
Thank you
God
for your
bless you all.
blessing.
Thank
Thank you so
you,
much.
sir. We are
Thank you
grateful.
so much. Have a great night. And tomorrow we are meeting again. Bless you with all the beautiful things done. He has been my friend and my supporter from last 8 to 9 years, right?
Yes.
And I cannot imagine without Walid heading the class. Walid was always my right hand. So whenever I take my mouse, I always see where is Walid in the class.
And he's always here.
and
Walid has
yes,
always been a wonderful man, sir.
yeah, Walid and Danilo from Philippines. They are the most wonderful people I have ever met in my life. I'm
Yes.
really great. They are in our life.
Beautiful.
There was one more person called Amadi from Singapore. He died. And that was the
Yes.
biggest loss we felt in our life.
Honestly.
May Allah give peace to his soul.
Amen.
May peace be upon to his soul for all his good deeds, whatever he has done for the progress of society.
Amen, sir.
We all know how his contributions have come to all part of the society, how he has supported us. And may on this day, we pray to Allah for bringing him peace and prosperity to his society. Thank you so much.
Amen, sir. Amen, sir.
Thank you, sir. Amen, sir. Thank you so much, sir. We are grateful.
Thank you, sir.